Well, good morning, everybody. Thank you very much for being here today. It's always a pleasure to get to talk about these topics. I'm going to kind of do a very broad background on complementary and alternative medicine, or what we call it at my shop at Gillette Children's, Integrative Care. We're going to cover, like I said, quite a bit, so if at any point you have any questions, feel free to write them down so that we can have them addressed at the end of the conversation. I also understand that I'm between you and lunch, so we will try to respect that as well. There we go. And I got a little ahead of myself. So this is obviously what I'm hopeful that by the time I'm completed, you'll have a greater understanding of some of these topics. And you should be able to respect and appreciate them just as much as I do. Now, one of the reasons as to why we are even talking about this today is because a lot of families and patients are expecting this. So we've started to do some of the research behind this, and some of the folks are showing that a lot of the complementary and alternative medicine practices are yielding very real and true benefit. As you can tell, this study down in 2013 did show that complementary alternative medicines were used for a variety of topics, including addressing not only pain, but fatigue, mood, anxiety, constipation, and sleep problems. And those folks desired more than just the routine medical cares. They also wanted counseling on diet, exercise, sleep, and stress management. And as you can see, it was quite effective at being able to help with that. Now, what I should also say is that we practice this within the same bounds as restorative care or Western medicine. So they're not separate entities, they definitely work together, which is the whole notion of the complementary part of it, so that we can continue to seek the restorative medicine and at the same time find these other methods of dealing with how we can address some of those distressing symptoms. Now, I thought a little bit in particular to some of the acupuncture, which I actually provide at Gillette Children's, in addition to my normal practice with pediatric hospice and palliative medicine. But acupuncture is also being shown to be quite effective. And again, specifically with regards to pain, it makes people feel better. And I think that's actually quite awesome. And the fact that we can have 40% resolution of symptoms, 100% resolution of symptoms in 40% of the cases is also quite amazing. And then finally, in 2016, there was another one specifically for pediatric headache that showed that in addition to dietary supplements, which I'm absolutely fine with, there's also these therapies that have been proven to be beneficial. I don't want to get too much down the science rabbit hole, so I just want to go back a little bit to make sure that you understand what's going on at Gillette Children's. So we definitely take care of children and young adults with special needs. This includes children with hydrocephalus. Again, we span our spectrum through the adult population as well. So we do take care of adults with pediatric onset disability. And again, I have a fair number of patients who have hydrocephalus, whether from spina bifida, congenital, or otherwise. Gillette has been around for quite a while. We were actually started in 1897 by Dr. Arthur Gillette, and it was our first hospital for children with disabilities. At the same time, however, we recognize that people living with disabilities encountered some severe limitations for their health care, education, and employment opportunities, which is what drives us to do what we do today. Again, just to get the spread of where I practice, we are a 60-bed hospital, so in the grand scheme of things, it's a smaller hospital. And in 2015, we had about 2,500 inpatient admissions. We also do a lot of outpatient work and clinic work. In my experience, that is where life happens, is in the community, not in the hospital. So we have 11 clinics throughout the Twin Cities area in greater Minnesota, and we had about 26,000 patients seen at about 150,000 clinic visits. All right, so that's a little bit about where I practice. Now we're going to talk a little bit about the history and philosophy of complementary and alternative medicine. So we, in the great United States of America, actually have a National Center for Complementary and Alternative Medicine within the National Institutes of Health, so the NCCAM. Now, they define complementary and alternative medicine as a group of diverse medical and healthcare systems, practices, and products that are not presently considered to be part of conventional medicine. At its heart, this is really a relationship-based form of medicine. Our goal is to understand the whole person in ways to help improve not only their illness trajectory, but also their overall wellness. We focus on therapeutic approaches using healthcare professionals, disciplines, all to promote optimal health and well-being. Now, the complementary therapies are a subset of integrative medicine. They are used as adjuncts, as I said, to conventional care, not in replacement to, but an adjunct or complementing normal restorative care. Now, there's a wide variety of these types of practices, but again, more of the philosophy at its center is the recognition of the primary importance of treating the patient as an individual rather than a constellation of symptoms. This is just a concept of patient-centered care. We also have the recognition that the family has the primary role in providing care, and that the role of the clinician is the one of a counselor, teacher, and advice giver, rather than an issuer of orders. There's also the recognition of family-clinician relationships are partnerships and not a hierarchical relationship. We also have the recognition of the importance of a sustainable healing environment and the inherent healing ability of the individual themselves, as well as the recognition of the importance of prevention and health promotion. So that was a little philosophy. Now just a history of the practice of complementary and alternative medicine. Again, we had finalized in the United States in 1992, the Congress established the Office of Unconventional Therapies. They later changed that to the Office of Alternative Medicine. It receives a lot of research funding, which is exciting to see. They started with a research budget of $2 million, and that's increased to $20 million. And then in 2002, they also launched an intramural program to explore complementary and alternative medicine treatment strategies as an actual NIH clinical center. So that's kind of the geeky side of being a doctor, is all the research pieces. Now, more of the history of actual complementary and alternative medicine in the United States, again, it goes back to the Native American medicine practice. Again, this is a system of healthcare where they focus on holistic approach to medicine that emphasizes the treatment of the entire person, including their physical, mental, emotional, and spiritual aspects. Now, as we kind of recall from our history lessons, Native American healers were often called shaman or medicine man or medicine woman, but they definitely had that notion of the intertwined nature of the natural and spiritual world, and thus they kind of developed symbolic healing rituals, ceremonies, and the extensive use of herbal remedies. Over in China, another bastion of alternative medicine is the practice of traditional Chinese medicine. Now, their whole thought and philosophy is based on restoring harmony to those with illness, and this has been going on for 23 centuries. Now, they also tried to tap into or harness the recuperative power and immunity through several mechanisms, including herbs, acupuncture, diet, massage, and exercise programs, such as Qigong and Tai Chi. And it's used widely throughout the world. Even older than traditional Chinese medicine is Ayurvedic medicine. This came from India, and this has been going on for 5 millennia. It's one of the oldest forms of a healthcare system that we have, and again, it goes back to a holistic healthcare approach. And it comes from the Sanskrit words of ayus, meaning lifespan, and Veda, meaning knowledge. And it's still in practice today. All right, now you got your philosophy, you've got a little bit of your history. We're going to talk about the modalities that we offer through complementary and alternative medicine, and this is basically what we do or what we consider on a practical level what alternative medicine is. So going back to the NCCAM, they kind of break it down into these 5 areas. Now, alternative medical systems is a category. This is basically says that this goes beyond a single modality and refers to an entire system or theory that is kind of separate from conventional medicine. This again goes back to the traditional Chinese medicine, Ayurvedic medicine, but also homeopathy and naturopathy. Mind-body interventions are really those things that tap into the human mind, but that we know have an effect on the whole human body. These include such things as promotion of physical health through meditation, prayer, and mental healing. Biology-based therapies, this includes a lot of special diets, herbal products, and other natural products such as minerals, hormones, and biologicals. This is such stuff as St. John's wort, ginkgo biloba, vitamins, and then such things as fish oil for the treatment of cardiovascular conditions. Manipulative and body-based methods is not playing mind games with somebody, but they're actually talking about physical manipulation. These are therapies that include, a lot of people would think of chiropractic, would be sort of one of the more common manipulation-based therapies. Here in the United States, our chiropractors are licensed to practice, and we also have, I'm a medical doctor, but there's also doctors of osteopathy, or DOs, and they also do something called osteopathic manipulation therapy. Massage is another manipulation-based therapy as well. And then finally, energy therapies. Gets a little out there. You have to be willing to start adopting some philosophical bases behind this. But this is sort of the notion that you can help affect healing through manipulation of the energy. This is such things that folks are experienced with Qigong, Reiki, therapeutic touch, M technique. Those are all different types of energy work that are done. Now that's a little bit stiff as far as how all of that works. Again, we kind of adopted it for us and our patients at Gillette. Just a brief nod here to one of our lifelong patients was James Grimm. And his folks set up a fund to promote integrative care at Gillette. Jim was a lifelong patient of Gillette until he passed away at the age of 42. And he felt very strongly about the use of integrative therapies and utilized them throughout his entire adult life, including massage therapy, music therapy, acupuncture, aromatherapy, and acupressure. Since he made it such a priority in his life, his parents wanted to continue that gift after his passing and thus endowed an integrative care fund for us to use a lot of these therapies at Gillette. So the verbiage is going all over the place, and that's just, again, we try to be mindful of it. As far as when you talk about the broad body, they kind of like to call that complementary and alternative medicine. At Gillette, we kind of adopted the name integrative care. We felt that more accurately described what we were offering and what we provided to our patients. Again, it was integrated with their normal care plans, and it's definitely a caring type of healing that we're trying to practice for them as well. It takes a lot, though, to make this happen. It's not just happening in isolation. It's not just one physician seeing patients in a clinic room and doing acupuncture. We recognize that in order to be successful for our patients, we had to build an entire team around this. So we had a committee that started back in 2011, and we were more formalized in 2013. But we recognized that, again, to meet the needs of the community, and more importantly, to meet our patients' needs, we had to do more, and thus we started our integrative care efforts. It's housed under the hospice and palliative care team because that's another holistic approach to patient care, and the two go very well together. On our team, though, we have many, many people working together. We have physicians, nurses, physical therapists, occupational therapists. We have folks represented from nursing as well, including even administration is present in order to make sure that our patients are definitely benefiting from these efforts. This is sort of just a visual example or model of what integrative care looks like. And it takes those four aspects, the physical, social, psychological, and spiritual, and definitely shows how they interact together. And we find that optimum health is achieved when we actually get all four of those represented at once. And therefore, we use that to promote overall wellness. We also recognize, however, that we didn't want this to be a concerted effort that we did for a few years and then said, well, wasn't that cool when we did massage back in 2016? So we felt we had to really weave it into the whole culture of the organization. In order to do that, we wanted to ensure that this was sustainable work that we could do. So we made sure that we had that adequate representation across all the fields of a modern clinic and hospital like I just was painting for you. And we also wanted to be very mindful about including the administrative staff so that they were aware of our efforts and could see front and center how our patients were benefiting from that. We also wanted to make this as easy as possible, so again, it kind of breaks some of the traditional molds of you don't have to wait for the doctor to order it for you. Any patient can self-refer into receiving integrative care, as well as any person can also recommend it, whether it's a bedside nurse or respiratory therapist. So it kind of loosens up a little bit of that hierarchy structure as well. And I've definitely had people come into my clinic and just like, oh yeah, I want that acupuncture. I have a friend of a friend who does this. And I'm like, great to meet you. Assuming they have appropriate diagnoses. And then we just wanted to make sure that, again, this was really woven into the fabric, so we made it easier for people to practice this. For example, the use of aromatherapy by our bedside nurses. They have to take their training once a year online, and they're allowed to do aromatherapy for our patients. And it's just become a very routine part of their practice, and therefore that makes it sustainable. All right, this is what we actually offer at Gillette. So we don't break it down into those other structures as the NC-CAM did. We just kind of lay them all out there as what we do. And we're going to talk about each and every one of these a little bit more in detail. Now, one of the things, though, is it's not just enough to say you do this. The question is, how do we let you folks know, and how do we let our families know? So we definitely developed a seminar series so that folks would know what we're up to. We had an overall integrative care fair in August of 2013, and that's where we just had a whole day at our Lifetime Clinic where we talked about acupressure, adaptive yoga, massage, nutrition and health, reflexology, and mindfulness. We also then thought about how could we do this again, and we thought, why don't we take each of our highlighted modalities and do an evening session on it? So as opposed to doing a whole day, which can make it challenging for some folks, especially if your medical transportation didn't show up that day, you missed the whole affair. So we have every Tuesday night, I believe it's the first Tuesday of the month, we do just a little mini spotlight on one of these sessions for an hour, having very healthy snacks available for everybody as well. And we call that our Enhancing Wellness series, and it's been really well received. And it's been, it's the first Tuesdays, I believe it's the first Tuesdays of the month. We are on break for the summer because that's our busy season at Gillette where we do a lot of surgeries. But we have 5 sessions from January through May, and then we'll do another 4 sessions at the end of the year. I'm looking at Candace, where we're going to do another repeat of the sessions at the end of the year. We charge a nominal fee, but we also have open scholarships to anybody just to make sure that there's no barriers for people being able to attend. But we don't want just our patients and families to know about it. We also felt it quite important for staff to know about it. Again, we really want the bedside nurse, for example, to know what we can offer our patients. So we have many seminars where we'll invite staff to experience some of these things and put a bunch of needles in people's ears so they would know what acupuncture was like as well. But again, more importantly, they need to have a working knowledge of what we can offer so that they can identify if it might be of benefit to a patient or family. Okay, now finally we're going to start talking a little bit more about each of the modalities. I'm going to focus a lot more on acupuncture. Again, that's what I practice, so I'm going to be able to talk a lot more about that. So you're going to get a little bit more of a mini lecture on acupuncture, but we're going to talk about each of these modalities so that you guys are aware of what might be beneficial to yourselves or to your children or family members. Aromatherapy, try not to call it to somebody who practices aromatherapy. They prefer the therapeutic use of essential oils. This is a lot easier for me to say, though. What it does, though, is it utilizes concentrated essential oils from plants to enhance the physical, emotional, and spiritual well-being. At Gillette, we use ginger, which is awesome for nausea, vomiting, upset stomach, arthritis, and constipation. We use true lavender, and I was told that it has to be true lavender for the management of anxiety, pain, insomnia, muscle spasms, promotion of comfort and relaxation. This is also obviously a lot of people use this for sleeping at night. It's pretty great for that. We use mandarin, which is a nice citrus smell, for the management of insomnia, indigestion, and nausea. And we use bergamot for the promotion of relaxation and calm. And that's, again, smells like Earl Grey tea. Peppermint is also a great one that's good for concentration and being energized. However, some folks say that there is a slight risk for seizure breakthrough. Since we have so many patients at Gillette who have epilepsy, we decided that even if there's a very small theoretical risk, if it in any way puts our patients at harm, we're not going to do it. So that's part of how we do this and making sure we're looking out for the best interests of patients. But that's another very common one. Anybody who goes to Whole Foods, though, can see an entire display of essential oils. They're all great. The way we use them at Gillette, in order, again, to minimize any risk of harm to the patient, we don't apply it directly to the skin, just in case there'd be a reaction, is we'll take a Band-Aid, put a couple drops on the Band-Aid point, make a little tent, and put it on their shirt. And that way they can smell it without any risk to the patient whatsoever. Biofeedback's been a great thing that we're using for our patients and young adults. And this is offered by our trained psychologists, and we used our Integrative Care Fund to make sure we had at least 4 psychologists trained in the use of biofeedback. This is really good at helping to treat anxiety, headache, and pain. It's usually offered at our institution for patients aged 8 and older, and they do have to be cognitively able to participate in the treatment modality. So it can be limited for some of our patients with more severe disability or for younger patients. But what we're able to do with this is the psychologist is able to help the patients learn to manage their anxiety, pain, and headaches by using non-invasive sensors. So it's just like a pulse oximeter or these temperature probes on the skin. An education to harness the power of the child's own mind. By the child being able to become aware of what's going on inside their body, they're able to gain more control over their own well-being. One of the great examples of what they do is they put the heart rate monitor and pulse oximeter on the child, and then they get to play a video game. And what it is a little guy on a jet ski that's going through this water course. And the calmer the patient becomes by lowering their heart rate, the faster the jet ski goer goes. So it's kind of counterintuitive, but it's just how it kind of works out for it. And then they always do these fun things like all of a sudden it starts storming out, which I don't think they should have a guy in jet skis when they're lightning out, but that's okay. Healing touch is really powerful. I think this is definitely one of the things we've noticed for our patients who have extended time or extended visits is sometimes it's tragic of like, just touch the child. Some folks get so afraid that they're so fragile that they kind of forget just the power of just human touch. Healing touch is not just human touch. It's an actual practice that folks are trained in. It's one of the energy therapies that we talked about in which the practitioners consciously use their hands in a heart-centered and intentional way to support health and to facilitate the healing process. At Gillette, we have 2 folks who are being well trained in doing this, one of our nurses and one of our child life specialists. And they're completing their training this year. The other kind of interesting thing for parents and family members of our patients is they often use you as guinea pigs at our Family Resource Center. So we'll often kind of do that for parents and family members. They can come to the Family Resource Center and they kind of trial out some of these modalities. And it's really kind of cool to see that happening. Massage is incredible. What we did at Gillette is, as opposed to hiring a licensed massage therapist or an LMT, we kind of did a little bit of a different version of that, and we wanted to have a broader impact. So what we did is send a group of 20 nurses, therapists, and child life specialists, therapists meaning physical and occupational therapists, and child life specialists to be trained in the application of what we call pediatric bedside massage. Again, not licensed massage therapists, but they are able to offer massage to our patients. We did a policy again to make sure we had that institutional support from administration and so that they were well aware of what was going on. And this has been really incredible. It's not just the neck rub or the back rub. It's actually using therapeutic massage for promotion of bowel movements after surgery. So they have this whole practice that they do for abdominal massage to help promote other things and just sort of relaxation. At the same time, it can be wonderfully helpful for relaxation. So at this point, what we do is we have these folks known throughout the hospital, and it's kind of like, oh, I really think, you know, little Katie here would do great with bedside massage. Is there anybody on this shift who can do that? And they're like, oh yeah, we'll make sure somebody goes over and sees her. We also work very closely, though, with everybody else. For example, the surgeons, after doing shunt replacement surgery, probably wouldn't want the patient to get a scalp massage. So we're very mindful of things like that as well. We also, again, want to promote this sustainability. So as opposed to sending 20 folks off-site every couple of years to learn this, we're actually training up 4 or 5 people on-site that they can then continue that train-the-trainer type of aspect. Some of the indications that we use more specifically at Gillette are for pain, comfort, anxiety, stress, constipation, and overall emotional well-being. Music therapy is one of the greatest things that we offer as far as what would fall under the umbrella of complementary and alternative medicine. I just remember when I was doing my inpatient rounds, I had a patient who was in the ICU for a long time, and I was very concerned. I would go in and never responsive, just kind of lying there, all these tubes and everything coming out of him. I'm like, oh, it makes me kind of worried about the prognosis. I wandered by one day when our music therapist was there. The kid was banging a drum. And I'm like, all right, you're fine. It's just me. But this was also one of the years where we were able to use our Integrative Care Fund again to really prove the concept. We paid for a half-time music therapist for a year to say, we really believe strongly enough that this can help our patients. And she made rounds on the inpatient wards on a regular set schedule. And after we proved that it was of such benefit to our patients, we now have 2 music therapists at Gillette. It's really very cool. But now specifically, music therapy is the use of music by not just a guy jamming with a guitar, but a board-certified music therapist, and it can promote positive change in behavior, functioning, and overall quality of life. Music therapy definitely works to help patients cope with just being in the hospital. It supports them during medical procedures, and it promotes physical and cognitive growth. A music therapist will tailor each session to the specific needs and interests of the patient, and no musical experience is required on the patient themselves, and it works for all ages. During a session, patients will have the opportunity to sing, move, or listen to music, write their own songs, and even play instruments and games. Osteopathic manipulation therapy. This was one that I alluded to a little bit earlier. This is not quite chiropractic care, but it's in that same area of sort of manipulation or an adjustment. At its heart, though, OMT is a holistic, hands-on approach to diagnosing and treating the body for a variety of symptoms, including musculoskeletal pain, muscle spasms, headaches, sinus disorders, respiratory insufficiency, infection, and constipation. What OMT does is facilitates the motion and balance of muscles, joints, tendons, and fascia, which are kind of the planes in between the muscles, by using gentle techniques, thus promoting the body's innate ability to heal itself. Dr. Dahlberg, who does OMT, is like, I don't crack people's back. Please tell them I don't crack backs. It's not that type of a manipulation. It's definitely much more of a soft tissue release, and it's really incredible to sort of see just how patients just feel better at the conclusion of one of the sessions. Acupuncture. All right, and we're going to dive down a little bit more with this one. I provide acupuncture. It's been a component of Chinese medicine for 23 centuries, so it's very well established. And it's really been taking hold for our patients. And it's also been taking hold as more of an actual scientific approach to treating specific areas of children's comfort. There's the American Academy of Medical Acupuncture, and there's the Medical Acupuncture Journals. And I was able to recently publish a case study on 9 of our patients that benefited from acupuncture, which was really cool to see. One of those being a young girl with a congenital hydrocephalus and headache. The history of acupuncture, these go back to our fine friends, the Jesuits. When they went all the way over to China in the 14th century, they are some of the first Western exposure to the Chinese practice of acupuncture. And they, being good Jesuits, wrote it all very down carefully and how to bring it back to France. And it's really kind of funny today, the French acupuncture and the Chinese acupuncture still quibble about where points are in this other pieces. I think it's funny. Anyway, it's been around for quite a while. Back in the good old days, they actually used to use porcupine quills as the acupuncture needles, and we've come a long way since then. At its heart, acupuncture is really about balance. And this is kind of how I try to tell patients. It's like through acupuncture, what I do is skillfully place needles at points on the body to access the energy or qi to restore balance. And then the whole yin-yang is not just from the undergrad days. It's actually the actual Chinese symbol for balance. And the yin and the yang actually do have a lot of meaning behind them. This is just one of the areas where they sort of highlight the difference between what is yin and what is yang. And one of the important things you'll see right off the bat is earth and heaven. The Chinese philosophy behind acupuncture is that humans are the conduit between earth and heaven. And qi, or energy, flows through the earth, through the human, through the heavens, back down from the heavens, through the human, through the earth. So it's this very essential component of how things are supposed to work out. They do attribute other qualities, as you can see, to what are yin qualities and what are yang qualities. And for when people get really excited about acupuncture, they start saying, well, you're acting a little aggressive. I think you have too much yin, and we need to pull it off. And I'm like, okay, I'll leave that up to those folks. I like to focus more on the way I was trained in this. And some of this, though, is going back to this concept of what is qi, or what is energy. This is very busy. Don't worry about that. The way I often talk to my patients who have the ability to interact at that level is talking about, well, you know how blood goes through blood vessels, qi kind of goes through meridians throughout the body. And then we kind of talk about how qi is when you're experiencing something such as pain, discomfort, or you're irritable or just not quite right. That's because you're out of balance and your qi is stuck. So acupuncture helps to unstick your qi. And that's one of the main goals. Qi gets a little bit more exciting than that, though. There's definitely, if you want to really get into it, they talk about defensive qi, natural qi, original qi, and how the qi is actually taken from the environment and into the body through the lungs and through the stomach and stored in the kidneys and all these other fun things, which we'll address a little bit. Once you accept that we have qi, there's also a notion that we have the other bodily fluids, so to speak. We have blood, which is then called zhu, jing, which they call your essence, and this is sort of kind of your moral character, or your inherited characters from your parents. And then jin ye is all of your other bodily fluids. Okay, going to those meridians, they are what we have are 12 different Chinese organs, which correlate to what we would call Western organs, and they're all responsible for something, and they're all paired with another organ and another organ set to make these different meridians. The first one is the Shao Yin Tai Yang. This is one that I use a lot. This is for Spirit and will are sort of kind of the gut reactions of what the Shao Yin Tai Yang are for. It's also a great one for back pain, knee pain, and some of those other aches and pains that some of our patients chronically experience. At the bottom right corner, you see the kidney organ. Now, this is an important one to the Chinese because it stores the Jing, or that original essence, and it rules the birth, growth, development, reproduction, and sexuality. It produces marrow, and which is obviously inside the bones, but one of the very interesting things they think of is that marrow of the skull is the brain. So when you have sort of neurologic disorders, they also kind of put those as ruled by the kidney. It rules water and water metabolism. It controls the inspiration and grabbing that qi from the air. It opens into the ears, so if you have ear or hearing problems, they say you have a deficiency of your kidney energy. And its peak time is 5 p.m. to 7 p.m. These peak times are kind of interesting because if you're your best at 6 p.m., you're probably a strong kidney person or a strong water person. Also, if you're really wiped out at 6 p.m., then you probably suffer from a deficiency of qi. The heart governs the blood, and it tells the blood where to go. It also stores the shen, which is what they kind of call the mind or the spirit. It opens to the tongue, and its peak time is 11 a.m. to 1 p.m. Then you go to the yang organs on the other side, which include the small intestine, which controls receiving and transforming. So it kind of digests the qi and makes sure it goes to the body. Peak time 1 p.m. to 3 p.m. And the bladder is sort of like a district official. It stores the fluids so that they can be excreted by its action of qi transformation. So basically, when you're all done with your qi and you have the leftover stuff, it gets rid of it for you. Its peak time 3 p.m. to 5 p.m. But like I said, this one is a great one for back pain, knee pain, as well as some of the neurologic issues. Now, Zhui Yin Shao Yang, this is a liver, master of heart, triple heater, and gallbladder. This is one that's great for vision and action, is sort of what we call the character qualities of this meridian coupling. The liver is a very important organ. It ensures the smooth flow of the qi throughout the body, stores the blood, controls the sinews. So folks that have kind of joint issues or tendon issues and ligament issues, this is a great meridian to work with. It also houses the hun, or the ethereal soul. Peak time 1 a.m. to 3 a.m. So if you're always waking up at 2 in the morning, you might have a deficiency of liver or too much caffeine. Master of heart is the pericardium. It protects the heart. It influences your relationships with people. Its peak time 7 p.m. to 9 p.m. Triple heater correlates more to your parasympathetic nervous stuff. So some of your excretion issues, urination, constipation, evacuation. It aids in metabolizing and digesting, and it has 3 heaters because the triple heater, but the abdomen, the thorax, the abdomen, and the pelvis. Peak time 9 p.m. to 11 p.m. Oops, and then don't forget about the gallbladder. It stores and releases bile and controls judgment, and its peak time is 11 p.m. to 1 a.m. So again, for a lot of folks with even spasticity, this is one meridian that I'll kind of work on. Also those patients with ligamentous laxity that have consistent joint pains and aches, I'll work on this meridian. Finally, Tai Yin Yang Ming has got the remaining 4 organs. This is more nurture and duty as sort of its big known qualities. The spleen governs the transformation and transportation, and it really controls the blood. It also controls the raising of qi, and it houses the thoughts. Its peak time 9 a.m. to 11 a.m. The lung actually rules qi and respiration. Again, they kind of think you breathe in the qi, your lung transforms that into usable energy and sends it to your stomach, which then shuttles it around. But it controls the skin, the sweat glands, and the body hair. They see the skin as an organ of respiration, which is actually kind of how we think of it in Western medicine as well. Its peak time is 3 to 5 a.m. and the lung houses the corporeal soul. The large intestine receives fluids and gets rid of them. Peak time 5 a.m. to 7 a.m. And the stomach controls rotting and ripening of food, which is just such a lovely way to think of it. But its peak time is 7 a.m. to 9 a.m. That's your brief background on that. The acupuncture points, yes, they actually teach us these. Yes, they expect us to memorize a lot of them. I don't actually remember all of them. I remember the ones that I use. But there are little charts that work for it. There are also charts for horses and cats and dogs, and I've not done acupuncture on a horse, cat, or dog. When I use acupuncture, the approach I think of are kind of, is this an energetic balancing issue? Is this a physical ache or pain, such as a biomechanical issue, or is it an internal medicine issue, such as constipation? Based on that, I can develop a program on how to try to help out the patient. If it's an energetic thing, this is just a quick sketch, but basically I place 6 or 10 needles on the patient, below the elbow, below the knees, and it just helps to balance it out. So when I see a patient is out of balance, I use this to restore balance. A lot of our patients have aches and pains such as chronically sore or tight neck, in which case I'll use more surface release technique, which is just physically trying to release tension in that muscle group. Or if it's a chronically sore shoulder, I'll use a percutaneous electroneurostimulation, or PENS. A lot of folks are familiar with TENS unit, which are sort of the pads that you put on and run the current through. This is just an upgraded acupuncture form of that. You put the needles in and then pass current through it. Sounds kind of horrific, but it's actually kind of pleasant. And that's sort of what a PENS treatment looks like to help treat a chronically bum knee. Auriculotherapy is ear acupuncture. This is a little map, and this is where the French and Chinese disagree on what gets mapped where. But essentially, you can map the whole body on the ear, as well as having master points. This is also a great non-threatening way to introduce acupuncture. Not too many people can see what's going on by their ear. So it's kind of a way to do acupuncture, get the benefit of it without having to worry too much about watching somebody put a needle in you. And again, for a lot of our patients who've had repeated medical procedures, coming at them with a needle is going to have a lot of needle phobia going on. So it takes a little while to warm up to them. Speaking a little bit about needles, I've done acupuncture as young as 2 years old. We don't use the big needles for them. We have these little press-on needles, so it's kind of like a little bandage with a little, really tiny little almost filament on it, versus sort of the toddler version, which is the same Band-Aid type thing with a little bit more of a point on it, and then we go up to the overall straight-up needles. So always I wonder, how do they ever figure this stuff out anyway? So I just think that's funny. The little picture of the mammoth with a bunch of spears in his backside. It says, oh, that's odd. My neck suddenly feels better. Those are a lot of the modalities that we offer at Gillette. I definitely want to leave some time for questions, but I also just want to do a few nods on how we respect and integrate this into the culture of Gillette. Taking all of these concepts of complementary and alternative medicine, that holistic approach to the patient and child, we want to make sure that we focus on that patient and child. So when they come to the hospital, they get to have the option of making one of these posters. And this just lets you know a few things about the child. It's like, hey, my name is William, call me Billy. I really like to talk about my cat. So, if Billy's upset, then you go, oh, hey, how's Fluffy doing? And it helps bring Billy around. It also just lets us know a few other things. Like I had a patient with osteogenesis imperfecta, but he would always clap his hands. I'm like, oh, great, he's happy. And the parents are like, no, don't do that. That means he's super stressed out. I'm like, sorry. But this just helps kind of give us cues on that, as well as just remembering and respecting the child as an individual instead of that shunt case in 73. We work with mind-body solutions. I think a lot of our children, unfortunately, learn a negative relationship between their mind and body, and we can kind of work on being respectful of that. Matt Stafford is a young man, when he was 13 years old, had a spinal cord injury and had become a paraplegic. And so he has done a lot of great work on kind of restoring that mind-body connection, being okay in your own body, not being limited by it. And they do adaptive yoga for our patients, and it's really cool to see. When we expand, we like to be mindful of healing spaces. So we advocated for a healing garden when we did an administrative office expansion. And it's just a great space where kids can be outside of the hospital, yet in a safe and controlled environment, and get a little bit of nature therapy too, which in Minnesota is like 4 months out of the year, but we still try. When we do big hospital design plans, we're also very mindful of the spaces that we create. Instead of just having another sterile clinic room with fluorescent lights and a cold metal table, we're like, how about the ability to have dimmable lights? How about the ability to have more natural types of furnishings and finishings? So we advocate for that. Granted, we're probably not going to get all of everything we ask for, but we want to be mindful of that. And then finally, just a little bit of a nod of parents and families that care for children as well. We want those folks to be sustainable, healthy, and full and complete individuals. So we do focus on that as well. We do have offerings for that, as well as staff who engage in this compassionate work on a daily basis. We want to make sure that people can show up and feel good about their jobs on a day-to-day basis. So we do have, again, we focus on that mind-body solutions for staff. We offer staff yoga in the mornings and evenings. We do events called Schwartz Center Rounds, which for those of you that may be familiar with medicine, we sometimes do medicine and mobility rounds, which is like, why did you screw up, doctor? And it's like, well, this shouldn't be about that. Let's actually talk about the emotional impact of caring for complex patients. We have team meetings. We have Tea for the Soul, which our chaplain sets out tea and cookies, and we don't talk about work. And then we have that Family Resource Center as well. So thank you, all of you, for being here and for wanting to learn a little bit more about this. I'm more than happy to take a few questions at this point. We're going to circulate with microphones if you have any questions.
Could you just post the first slide that had the dietary supplements on one more time?
Yeah, some of those dietary supplements are straightforward. Vitamin D is one of the hot buzz ones that everybody likes to talk about.
Well, I've just heard a lot about magnesium lately.
Magnesium can help for some muscle spastic type things. Again, none of these are replacements for currently prescribed medicines.
Right.
But they're just sort of dietary supplements that can be helpful. Again, vitamin D is a big one. Magnesium can help for muscle spasms, as well as some things such as grinding of teeth and even restless leg. Oh, I think I must have, there's a few. CoQ can be expensive. Butterbur I had never heard of. Melatonin is a good one for regulation of sleep. Some of these things you do have to be a little bit careful for. One of the problems with supplements is that they're not regulated. So you can have Nature's Valley supplements are going to be different than Organic Venture supplements. So it's a little bit, you have to watch about quality and purity of what you buy.
Just to follow up, like say, if I wanted to start, I mean, I do the melatonin to sleep, but like if I was going to start vitamin D, like how do you know where to start, like on dosing?
Great question. Most pharmacists are able to help with over-the-counter medications interventions. You should always discuss with your physician before starting a new medication, dietary supplement, or anything else, because there might be some interactions. For example, like the St. John's wort sometimes interacts with other medications, so we need to be aware of that. But when you look at vitamin D, most of the time, if you clear it with your physician team, the pharmacists at Walgreens can help you decide what a good starting dose would be, as well as kind of, you know, this is, because you're going to find 5,000 different preparations of vitamin D. Right. They're like, the D2 is just the same as the D3, is just the same as the complex, blah, blah, blah. So I would definitely check with your physician team to make sure they're cool with it, and then work with the pharmacist. Yes, good question. Right next to you.
This is obviously a great model, and I've noticed at times when my child gets more holistic treatment in a hospital setting, he actually does better. But from hospitalization to hospitalization, we've noticed that alternative or complementary medicine ebbs and flows, probably related to the ability to get reimbursement for it or funding for it. But clearly, and I don't know how many studies are done on how helpful it is to the patient, but do you see this as possibly becoming a model for care for children in hospitals, and how might we be able to help make that happen, or you
Definitely.
be able to help that happen?
No, a lot of great points there. I appreciate the comment that this is a good model of care. We think it serves our patients very well. You're also very true about kind of the ebb and flow. And it's like, didn't they do this back in the 90s as well? And what happened since then? And you're right. That's also why we wanted to ensure that this was a sustainable model. We didn't just hang out our shingle and say, hey, we're doing massage this year. We said, no, let's build it closely, grid this coalition of support for the whole hospital so that it's not prone to the whim fancy of whoever's in the CEO's office. So that's how we kind of try to be mindful here. But how folks can try to ensure that that is helpful in your own parent institutions would be to ask for it. I mean, that's one of the great things is when patients and families start asking for it, then that people start kind of paying attention. If you're like, well, you know, not that you would do this, but you know, at the other hospital, we were able to get massage. What's up with your hospital? But if there's that community expectation, that really drives a lot, let alone being the fact that it's in our patient's best interest. But having that as an expectation of the community starts really to bend people's ears. Because you're right, it's not a money maker. It's not like my acupuncture is, you know, gonna really what keeps Gillette in the black. But it's definitely it's best for our patients, and that's really what's important to us, is if it can provide the best care, then that's just sort of the environment of care that we want to be able to provide. Mm-hmm. Exactly. Yeah, we definitely would like to share the wealth. But good question, thank you.
Anyone else? Question?
Yes.
I have a question too. Thoughts on cranial sacral adjustments in hydrocephalus patients?
And some of this stuff you have to be careful of. Craniosacral, we don't do craniosacral at our place, but our OMT folks are trained to be able to do that. So some of those folks, what you always want to do, and especially with folks who have shunts, not everybody with hydrocephalus has a shunt, but we have to be careful of, I don't want to mess with that. Very obvious example is acupuncture. There's a lot of points that I do on the head. I'm not going to put an acupuncture needle anywhere near a reservoir or a shunt tubing. I have to adjust my treatment if that's what I would do. It's like, oh, this would be great, but your shunt's there. I'm not going to put that at risk, which is a great point. So anytime you do look at any of these things, and if some of our kids have had fusions and backflip pumps and other things like that, you want to make sure that the treating physician team is aware of what you're seeking and is okay with that. And this just goes back to when we did this, we were very, very mindful of that. Again, just looking at the massage, we had to tell our back surgeons, don't worry, we're not going to do a back massage after surgery. It's okay, but they needed to kind of have that reassurance. So good point. Check with your physician team before you engage in some of these activities. Yes?
Okay, now I have 2 follow-up questions.
Fantastic.
So to follow up on that, how do you recommend finding somebody who you can be comfortable with being as careful as you are, as if your hospital or your doctor doesn't know anybody to refer you to?
You're right. There can be a scarcity of resources on who's able to provide this. Again, we're very lucky that we took the time and energy and we're very thoughtful all along the way. And then I sought out acupuncture training. We had hired a DO, and it's like, do you want to do your OM2? He's like, I get an opportunity? And he's like, absolutely, I want to do that. So we were very careful about that. But what if you're in a less resource-rich environment? Some of the times you just, again, make sure it's okay with everybody first. Sometimes I like chiropractors. There are some shady ones. I not try to slam anybody, but once somebody starts saying, hey, if you buy my vitamins for $300 a month, it's like, okay, you might want to just do a timeout and check. But generally, people are very well intended and want to help out. A lot of chiropractic offices also have acupuncturists affiliated with them, also have massage therapists affiliated with them. So even in resource poor areas, that's generally a decent spot to start. It's not necessarily going to get you the help in the hospital, though. But that would be sort of one area that you can start looking for that. When you do look at more hospital and clinic-based, one of the questions is seeing if they have a palliative care team. Because that's another area that at least is going to have that holistic approach to the patient and might be able to start finding local resources for some of the other complementary alternative therapies.
Okay, and that kind of leads into my second follow-up question as far as, is there any precedent for doing this in adult hospitals?
Yeah, absolutely. Some of the models we use are with an adult hospital in the western suburbs, and they have a very, very well done setup where it's essentially like you get your menu for the day of what you want for breakfast, lunch, and dinner. It's like, do you want acupuncture, massage, or healing touch? It's like, oh yeah, that sounds nice. We don't quite have as many resources to do that, but that definitely exists, as well as a model on the Penny George Institute affiliated with Abbott Northwestern here in the Twin Cities, which is an adult hospital. They do a great job of all these complementary and alternative therapies as well.
Thank you.
Any other thoughts or questions? Yes. Absolutely. What have you got?
What about taking some of these and using them at home? Obviously, not the acupuncture, but
I just draw little pictures and say, just go for
some
it.
safety pins. But like the aromatherapy and the massage, how would there be ways for us to learn to do this for our own families?
If you have resources available with you and your hospital, just ask. Because we definitely want to. Even some of the bedside massage, that's the point, is we had a research study that was fantastic for babies with torticollis. So they kind of get their head twisted off to one side and they can get a bad flat spot. Our physical therapist worked with families on how to do the massages of that tight muscle, and it not only improved the child's torticollis, it greatly improved parent-child bonding. So it's like all kinds of good things happen. So we definitely, with the massage thing, our nurses are great at training the parents, like, this is how you can help out little Billy at home. The aromatherapy stuff is also, honestly, go to Whole Foods and see which ones smell nice. That's kind of what it comes down to. We've had some families be so savvy, it's like, oh, I've got this one that I call liquid morphine. I'm like, okay, we probably don't want to call it that, but, you know, so they'll kind of do that as well. And those are ways that you can do it. If you're concerned about, is this safe for my child, just ask the physician team again. There are limits, though, and obviously if there's risk of harm to the patient, we had one family who liked to nebulize their essential oils in the child's nebulizer. We're like, okay, it smells really nice in here, but no, you can't do that. You know, that's causing a chemical pneumonitis. So sometimes it's like, just because you think it's in your child's best interest, we'd like to make sure that we balance that with the thing of like, if it introduces harm or risk of harm, then we're going to probably counsel against that. But yeah, some of these things are great at home. Just ask the folks providing it. Because even with the acupuncture, you know, the C bands for the nausea point, you know, I have a patient that comes in routine and she goes, where's that point again? And I was like, right there. And she goes, okay. You know, but it's great. It helps her nausea. So just ask the folks and they can do it. But some of the easily transportable ones is massage essential oils. Those are ones that can be done at home. Yes.
Yeah. Oh, yeah. I have a. Thank you for this talk. I think it's a really important issue of care. I work at the Children's Hospital of Oakland in the Bay Area in California.
Great hospital.
Sorry.
It's a great hospital.
Yeah, it really is. And we have pretty organized music therapy program, and I'm very interested in kind of adding to that. So I'm glad that you mentioned connecting with palliative care. I think that's a great idea. And if you can offer any other resources, like who else to connect with and which modalities maybe to start with.
Yeah, some folks, we did get a lot of help, or just even conceptual help from the Penny George Institute in town, just kind of be like, how do you guys structure this? We sent folks out to that one adult hospital to be like, how does that roll out as well? There's also stuff, if you're at all interested, and I'm sorry, I apologize, I don't know if you guys have my contact information, but we're happy to send you our draft policies. It's like, this is our aromatherapy policy, and it's very administrative speak-wise, but that's also what administrators want to hear. So any of those things, you can also contact us, and we'd be happy to support. Yes, sir, and then we'll get to you.
So just to go back for a minute, you spoke about the cranial...
Craniosacral therapy?
Yes, yeah. When you spoke about that, you saying, like for people with shunts and hydrocephalus, that's typically not a good thing to engage in?
Definitely need to talk to your team about that. And that's the one thing is that I definitely want to reinforce is safety first. Yeah. These are all really good sounding ideas, but if it in any way puts you or your child at risk, it's not worth it. So some of these things you just want to say, hey, I went to this lecture on complementary alternative medicine. Do you think it's cool if my kid gets this? And be like, absolutely not. I'm like, okay. I definitely defer to that. But there are you want to make sure that if something sounds good, and the other thing too is a lot of folks will do a modification of that. So like, well, if craniosacral is contraindicated because of shunt presence, maybe we can do a soft tissue release in the upper back.
And so you might not be even a candidate for it. So.
Yeah, so you definitely, just talk to your primary treating team and then the person delivering the care. And they should be able to help walk you through that because some things just might not be within their interest. Another really good example is the use of that percutaneous electroneurostimulation or PENS. If a kid has a VNS or vagus nerve stimulator, I'm not going to start passing current through their body. So it's just like, I'm sorry, I can't do that. It's not safe. But good question. Yes.
Hi. I have a daughter who 18 years ago had her first shunt put in, and she's had 3 revisions, 3 craniotomies due to benign brain tumors. We have stood on our faith being Christians. And I don't know if any of you know Carolyn Leaf. I just heard her last year, and it kind of put in perspective some things that I think had a great impact on our daughter's healing. And science has proved the Bible, and that when you speak the biblical words, there is a change in the brain. And our daughter was quoting scripture. She reads it, she continues to do it, and she is continuously being healed. She had to learn to walk, speak, swallow, use the left side of her body, and she was going down Abbott quoting scriptures. And I believe that she had a change because our cells are always changing every few days. But if you read Carolyn Leaf, or you can watch her, and she's on TV, I had a big insight into what was going on with our daughter. She owns her own home. She works for Medtronic. She is in clinical research. She got her 4-year degree going through these surgeries. She has her master's degree. And she is doing things they never thought she could run. She runs, she rides horse, she bowls, she plays basketball, volleyball, things like that. So
That's one of the definite aspects for complementary alternative medicine, or the holistic approach, is that spiritual piece. Everybody's going to have a different spiritual journey, but we need to respect that as a potential part of the child's and young patient's care. And in hospice and palliative medicine, I am more than happy to bow to whatever gets our kids through. Because there have been many times where I am now seeing children in follow-up 7 years later that I didn't think would make it through that summer. So spiritual care is a very important aspect of the holistic approach to children. Yep. Perfect. Yes.
I've done acupuncture, I've done aromatherapy, and I've done some of the breathing work, but I want to get more into that because I think that's a good thing. I've done the guided imagery and massage therapy and music therapy, and getting more into the nutrition and, like I said, the spiritual part. But it's been a huge difference. And I do the ear acupuncture, and I do the ear beads, the acupuncture beads. And the woman that I go to that does my ear acupuncture, she has me lay back in what's called an anti-gravity chair. And you lay back in this chair for an hour with the lights out, and she has the ear acupuncture in you, the needles in you. And like he said, if you're freaked out by needles, you don't want to see them at first, but doing that. And then she puts the ear acupuncture beads on, which go on the back of your ear. They're just a little ball on a Band-Aid, and they stay in 2 weeks. I found that it just calms me down. And with the massage oils, I've used them even on my skin, but like I said, you ask, and I ask where I'd go to buy them. The lady used to be a heart nurse, which I have heart issues too. So she tells me, yes, this massage oil and this essential oil is good to do together. But she said, like he said, you want to try a little bit. You don't want to just all of a sudden put it on you and think, oh, that's going to work. Or put it on a cotton ball to see, because I have sinus issues or I have migraines. So she said, try that first.
That's awesome.
And the vitamins, nutrition. I was just found out about magnesium because I had migraines.
There you go.
And it has made a huge difference. I still have them, but not as often and not as severe.
Excellent testimonial. Quick breath work, if anybody wants one, is this in 2, 3, 4, out 2, 3. Hold 2, 3, out 2, 3, 4, 5, 6, 7. So 4, 3, 7 is just one you can use to totally calm down. So in 2, 3, 4, hold 2, 3, out 2, 3, 4, 5, 6, 7. That's great.
Well,
Yes.
last question.
Last
We've
question.
just got one time.
I just wanted to add in, my daughter is 28, and she's had 76 surgeries and has a lot of every second of every day head pain. And she tries many different things, but she also, similar to the TENS unit, got an occipital nerve stimulator, and it has helped mitigate for many years now. It doesn't take it away, but that in combination with other things have really helped.
That's awesome.
And it's not like you're manually taking the TENS unit and using it. It's implanted, it's there, and it helps.
Yeah, it's great to discuss those treatment options with your team, because there may be surgical interventions or procedural interventions which can also be of benefit to your children and patients. Thank you all for your input, for your participation. I'm happy to answer any questions afterwards if you have anything more.